So this meeting is recorded. So inshallah, if you miss any part in this meeting, you will find the recording. And usually I will apply and upload this video to YouTube so you can watch it at any time later. So at first, I am Dr. Osama Al. I have MRCOG and I am an examiner in Part 3 exams. And I am an instructor for MRCOG Part 2 since year of 2017. So inshallah, this coming batch, which is preparing for July 2024 exam, is batch number 15, inshallah. So I'm thinking that most of you or all of you are preparing already for this coming exam in July 2024, inshallah. I know that MRCOG Part 2 exam is challenging, but studying it is very useful. Really studying Part 2 exam is the most important part and the most useful part for your practice. There is much big difference in your performance in the clinic or in the hospital before studying and after studying for this exam. So take it as a chance. I always think that this can be the last time in your life that you will study hard studying, gynae and OBS. That's why take it as a chance. It's not only a matter of passing an exam that inshallah all of you will pass. No, it's more important than this. Okay, if you study very well for this exam, you will feel big difference and great improvement in your performance in your clinic and in your hospital. So please take it serious. I know that when we are studying for postgraduate exams, we should not be very anxious. Of course, that's right. But it doesn't mean that we will be lax or just to make our target. I will study some recalls, I will study some question box, then I will go and pass the exam. It's not that easy. Although some doctors may pass the exam with this technique. Okay, but unfortunately, many will not be able to pass with this technique. Otherwise, it was going to be very easy. It's not that easy. Okay, and if you compare between two doctors, one of them got MRCOG after hard studying, another one passed also MRCOG but didn't study very well. Of course, first one is more confident, more reliable. Believe me, when you are a member to the Royal College, you will be considered like a source of knowledge in your hospital. So your colleagues will choose you so they can answer you and get the updates about the guidelines and the recommendations from you. So you have to be a reliable person. It will be not good if they ask you what the guidelines say about this and you say, I don't remember. I just solved some recalls and I was lucky to pass. No, this is not very good at all. So let's make our target to be reliable doctors and to study very well for this exam. Part 2 exam is different from Part 1 and Part 3. Part 3, its main core is the basic knowledge and some clinical knowledge. Part 2, 100% clinical knowledge. Then Part 3, how to apply this clinical knowledge. Okay, that's why Part 2 really is the most important one, because this is the core knowledge. Even in Part 3 exam, we assume that you have good knowledge. That's why Part 3 exam is not knowledge exam. We assume already, as long as you passed Part 2, you have good knowledge. Doctors who passed Part 2 exam without studying well, they face another problem in Part 3 exam, that they may not feel confident enough. They may think of re-studying again Part 2 material, so they can be ready for Part 3. Okay, also, as I said, Part 3 exam is not mainly knowledge exam, because we assume that already you have the knowledge. That's why you passed the Part 2 exam. Okay, so if I introduce myself, okay, I had the membership of the Royal College since 2020. So this is the 4th year. They passed fast. Just soon, I used to say it's 1 year, since 1 year, then since 2 years. I didn't even feel the third year actually. Okay. And I am an examiner for part 3 exam, whatever online exam or physical exam in Egypt, because we have now center for part 3 exam in Egypt. I participated as an examiner in many online exams for the Royal College for part 3 and in 2 physical exams for part 3 exam in Egypt. Also, I have a certificate from Harvard, USA. It was a course for duration of 1 year. It's called Training to Teachers. It's about teachers, how they can do the training and how they can teach. Also, I have the Egyptian Board of Gynecology and Obstetrics. Also, I passed level 1 British Society of Gynae Endoscopy. It was a course and a certified exam in London. Also, I am currently in Birmingham IVF diploma. It's in conjunction with Birmingham University in UK. Also, I am now having endoscopy diploma in conjunction with German Society for Endoscopy, including both laparoscopy and uh, hysteroscopy. Also, I have a diploma in Egypt, a master degree. So I was also very proud to be a doctor working in UK for NHS from January 2023 until September 2023. This was my hospital. This is my photography from my camera. It's called St. Mary Hospital. Okay, and actually it's amazing place. The nature there is amazing. Okay, green and blue, there is sea because it's an island. Okay, green color everywhere. Okay, and actually the hospital was fascinating. Okay, this is the hospital, here this one, and this is a lake inside the hospital. In this lake, there are fishes, ducks, and some birds. Amazing nature, actually. Okay, this is a picture from BSGE course I had in London. It was hands-on training, then certified exam. Okay, so let's talk about part 2 MRCOG exam and how we can prepare best for this exam. You know that MRCOG is made of 3 parts. Part 1, which is mainly basic science and some clinical knowledge. Part 2, mainly clinical knowledge, 100% clinical knowledge. Then part 3, which is a practical exam, how you can apply what you learned in part 2 exam. Among these 3 exams, part 2 is the most challenging because its curriculum actually is very big. All NICE guidelines related to gynae and OBS, all green top guidelines, took articles, scientific impact papers, recommendations from Faculty of Sexual and Reproductive Health, also from BASH, BHEVA, and other sources. So it's really big curriculum. So our target in this course to make it concise and easy to be studied as possible. It's not easy that you go to the RSOG website and search for a guideline. Then you go to NICE guideline to search for another guideline and so on. So one of the good things in this course that everything is present in one place. Even talk articles are summarized in our material. Dr. Osama, all talks? My answer, of course not. Because with every issue, there are about 10 reviews. So we are talking about around 40 reviews per year. If we talk about last 5 years, we are talking about 200 reviews. Of course, not all the 200 reviews are with the same significance and importance for your exam. Some of them are more important, some of them are less important. So I select what is more related to your exam because talk articles are not only for doctors going to have MRCOG Part 2 exam. Doctors in gynae and OBS training in UK, they pass through 2 years of basic training called Foundation Year 1 and 2. In these years, they learn from gynae, obstetric, and others. Then they become more specialized in second year in gynae and obs if they are interested in gynae and obs. After that, they start 7 years of specialized training. These years are called specialized training year 1, 2, 3, 4, 5, 6, and 7. So there are 7 years of training in gynae and obs. Please notice, not all doctors working in UK are trainee. For example, I was not trainee. So there are two pathways in UK. Either you are in the training system or not in the training system. The advantage of being in the training system that after you finish these 7 years of training, you will receive a certificate called Certificate of Completion of Training. Then you start advanced training sub-specialty module to be a sub-specialized consultant. MRCOG exams are integral parts of this training matrix. To pass from ST2 to Part 3 to ST3, you should pass Part 1 MRCOG. And to pass from ST5 to ST6, you should pass Part 2 and Part 3 exams. So there is no ST7 unless he passed Part 1, Part 2, Part 3. So it's a basic exam for all doctors in the training system. Even if you are not in the training system, also you passed MRCOG. How come? Because one of the most important pathways to have a job in UK in NHS is to pass MRCOG. So you can get the membership, then you can do the GMC registration. So by any way, if you are a trainee or even not a trainee, you are called a specialty doctor like I was, you have to pass MRCOG exams. That's why you will find always in the regulations. There are some regulations if you are a trainee, other regulations if you are not a trainee. They have some difference in the regulations. At anyway, RCOG exams, MRCOG membership is a must, whatever you are a trainee or not. How we can pass these RCOG exams? It's not easy, okay? And it's famous that it's one of the most challenging, let's not say difficult, of the most challenging gynae and obs exams all over the world. From this level of difficulty comes the importance of this certificate and of this membership. If it was just an easy exam, everybody can pass it with minimal studying, the certificate was not going to be important. So we have to understand its difficulty. Its difficulty will lead to its significance. Okay, as you know, easy come, easy go. What is can be easily obtained, it's not highly significant. So you need hard working. This hard working will not only help you to pass these exams, also it will help you to have the good knowledge that you will use all over your life later in your career. So it will lead to more improvement in your performance and better care given to your patients, which is very important. That's why we work to give better service for our patients. As the college say, for women health. Okay. Also in this way, please don't be alone. You should have a company, study partners, okay, doctors you are studying with. It's very helpful. Really, the way is long and needs much work. If you are alone, it will be again more difficult. But if you are in a company, okay, you have study partners studying together, you will encourage each other. And also you will help each other. One of the important techniques to learn is to teach others. For example, if I learn a new topic and I try to teach this topic to other doctors, to other candidates, it will help me to memorize. Okay, we remember about 90% of what we teach for others. If you just attend the lecture, you were not interactive, you didn't interact, you didn't study this lecture later, you can remember only 10% of what you attended. So only not to learn, we need also to teach what we learn to other doctors. So when will be the coming exam? The coming exam in 3rd of July 2024. And this is a problem that the duration between January to July is shorter than the duration from July to January because the exam of January usually in second half of the month, while July exam at the beginning of July, as you see. That's why time factor is important. And all doctors planning for this July exam, we need to start studying this coming week. Okay, so we are not trapped and we are not constricted in time. So we need to study as soon as possible, inshallah. It's very important that all doctors planning to have July exam, you should apply what's called expression of interest. It's a performer present on the MRCOG website. Just you will enter your data, your name, your email address, then subscribe or submit. You will do submit. The college will understand that you are planning for part 2 coming exam, which will be in July. Okay, so please, all doctors planning for July exam today, okay, because many doctors, unfortunately, they can forget to do it and they will not be allowed to enter the exam if they pass 29th of March without doing this expression of interest. It's present now, so please do it today. Okay, log in, go to MRCOG Part 2 exam, find expression of interest, write your data. Now the college will understand that you are planning for July exam. You don't need, or they don't send you an email confirming that you did submission. Once they said after submit, thank you, it's done. They don't send emails confirming that they received your expression of interest. They send the data about the coming exam only for doctors who did suppression or expression of interest. So you need to do it better to be today. Even if you are not going to have July exam, please do it. You may change your mind. And there is no any problem. If you do expression of interest, then you didn't book for the exam. It's not a problem at all. You have the right to do that. Booking for the exam will start 23rd of April, which is about 2 or 3 months before the exam. Booking for the exam will stay to be open more than 1 month, but all of us, we need to book for the exam in the first minute. One more time, in the first minute. One more time, in the first minute. Because with every minute passing, okay, there are many doctors are trying to book for the exams and seats usually are not enough. That's why we need to book in the first moment. So we can find a place in the nearest center present to us. Then about 4 weeks after the exam, the result will be released. Best wishes for all of you in the result, inshallah. This is how expression of interest looks like. You write here your college number, email address, first name, family name, tick, finished. As you notice here, there is a security check and nothing present here. If this appears to you, please try to find this expression of interest form using another browser, because some browsers can prevent a CAPTCHA here from appearing. Okay, so if you didn't find a CAPTCHA here, try another browser. It's just a matter of browser allowing or not this CAPTCHA to appear. This is how the exam looks like. The exam is computer-based in centers called person view centers. Person view centers are almost present in every country, and you will find many centers present in your country. When you book for the exam in the first moment, you will have the chance of choosing the nearest center to you. So you are not tired in the exam, you don't need to travel long distance for the exam. In Egypt here, we have many centers. There is in Alexandria, there is in Cairo, and there is also in El Mansoura. So multiple centers present in every country. The exam is computer-based. You go to the exam center, Okay, 1 hour before the due time, they prepare, they check your ID and confirm that you are the one booked for the exam. Then you are allowed to sit for the PC so your exam can start. So exam is computer-based. And also our studying will be computer-based. So we are familiar already with some of the technology. Once you finish session one, you submit that you finished session one, then you have a break of 1 hour. Then you start session two to solve the second session. Once you finish second session, okay, your exam is ended, and now you can have a break, you can enjoy and wait 4 weeks until the result appears. So what is the fees of the coming exam? The fees depending upon which country you are settled in. If you are in UK, this is the fees. Okay, if you are in Band A countries, that's it. Band B, that's it. Band C, that's it. Band A, Band B, and Band C, they made this classification depending upon the national income in this country. So rich countries in Band A, intermediate Band B, poor countries Band C. For example, Egypt is present among Band B. Payment for the exam is done online, that you can pay by your Visa, or can be done by bank transaction. But bank transaction takes time. We need to book in the first moment. So usually by Visa or MasterCard, of course, talking about online payments. So how the exam looks like. MRCOG Part 2 exam is made of 2 sessions. It's computer-based, as we said. There is session 1, not paper 1, it's not paperwork anymore. Then 1 hour break, then session 2. Every session made of 3 hours. In every 3 hours, you have to solve 50 single best answer and 50 EMQs. The same in second session, 50 single best answer and 50 EMQs. Single best answer, we are all familiar with it. You receive a question and 5 options, and you have to choose the single best answer. What does best means? Best means others also can be right. Yes. So all 5 options can be right, but you have to choose the best one. This doesn't occur with easy or simple studying. It occurs with deep studying, understanding what is behind the words in the guidelines. Okay, because you want to choose not the right answer. You want the best answer. Then EMQs, which is more challenging than single best answer. In EMQs, you receive many options, can be 25, 30, 20 options. Then you receive 3 questions. For every question, you choose the best answer among these 20 or 25 or 30 options, whatever their number. That's why it's more challenging. And they made this EMQ to decrease the chance of choosing the right answer by luck. In single best answer, you have 5 options. That's why you have 20% chance of getting the right answer by luck. In EMQs, we are talking about 20 to 30 options. So chance of luck, less than 5%. So there is no luck in EMQs. Throughout our course, we will be trained how to solve the EMQs. But even after training, still EMQs are more challenging. If I ask you what you want to have for lunch today, and I give you 3 options, it's easy to choose. But if I asked you, what do you want to have for lunch today, and I gave you 30 options, it's very difficult, right? Although the question itself is simple, what do you want to have for lunch? Okay, but usually giving more options will make it more challenging and more confusing. Okay, and this will decrease in the exam the chance of luck to get the answer by luck. That's why studying, and training are very important for this exam. How many times you can have the exam for part 2? There are recommendations for the trainee and recommendations for doctors who are not trainee. Most of us, even if working in UK, we are not trainee. If you are a trainee, you have 6 trials for part 1 exam and a similar number for part 2 exam. But if you are not a trainee, like most of us, no upper limit. So you can have unlimited number of trials for part 2 exam. So no problem. Even if you didn't pass in the first trial, don't worry, the number of trials is unlimited. And from my experience, that usually doctors are passing from the first trial versus doctors who passed from second or third trial, you think which one will have more knowledge after passing the exam? For sure, the doctor who tried more than once, because he studied more than once. Believe me, the difference in the knowledge is much clear. Okay, doctors who pass from first trial, okay, they passed from studying once. They are brilliant, of course. Okay, but also doctors who had more than one trial, they studied more than once. The data will be kept more in their memory. I passed part 2 from part 1. Okay, but since then in 2016, I still study until today. So it was not enough for me that I just passed from first try. I still study every day all over these last 7 months, 7 years, sorry. So doctor, we will not stop studying after the exam? Of course not. We don't stop. Okay, because you know that science and the knowledge is changing, increasing, updating. If you stop studying, actually are not stopping, you are returning back. Okay, because the knowledge is going forward. If you are in your place, you are returning back actually. That's why even after getting the membership, you will still study, reading guidelines and reading took articles. As we said, you will be the source of knowledge in your department. Because everybody all over the world in the gynae and ops doctors, they know what is the significance of MRCOG certificate. It's not that simple certificate. They know it comes by hard working. So if you are a trainee and if you are not a trainee, we don't know what is the difference. One of the most important things that you have to study well for part 2 exam, that this will make you more ready for part 3 exam. If the number of part 2 exams is unlimited, the number of part 3 exams only 4 trials. Doctors who cannot pass part 3 exam in 4 trials, actually, and unfortunately, they need to enter again part 2 exam. If you are studying well for part 2, inshallah, your chance very high to pass from first or second trial in part 3 exam. Okay, after passing part 1 MRCG, what is my time interval that I should have part 3 exam? Okay, it's a variable if you are a trainee or not. If you are a trainee, 7 years after part 1, you should have part 2 exam. If you are not a trainee, and if you are a doctor who passed the part 1 before 2013, you have 10 years. Can you please write on the chat in which year you passed part 1 exam? Please write on the chat in which year you passed part 1. 2016, 2020. What about other doctors? 2023, 2017, 2014, 2023. Okay, nice. So all of you are fresh part one aspirant within the last 5 years, okay, with some exceptions. So please, if you are before the last 5 years, don't waste your time. You should have part two exam at least once. Because if these 10 years passed and the college thankfully added additional 2 years because of the COVID pandemic, there was a problem in booking for the exams. So total now 12 years, you must have a trial for part two at least once, even if this trial was not successful. Even if the trial was not successful. Okay, but at least have a trial once. So you can break this time interval limitation. So doctors having the exam before March 2013, they have 10 years, and the college added additional 2 years because of the COVID pandemic. So 10 years plus 2 years extra because of the COVID pandemic. Once you pass part two exam, you need to have part three exam, usually within 7 years. Okay, and this is an email from the college talking about the additional 2 years. Okay, this was one of the doctors who passed part one in 2016 and asking about the time interval. They replied it's 10 years and they added 2 years more because of the COVID pandemic, because it led to difficulty in having a seat in the exams. So I gave this course for part two since I passed my part two exam in 2016. And as you said, inshallah, the batch starting coming week is batch number 15. Every batch takes 6 months preparation, 5 to 6 months. Okay, and alhamdulillah, many doctors passed part two exam using my course. Okay, this was my first batch in 2017, July 2017 exam preparation. Okay, then 2018, 19, until now. Okay, so what are the components of the current preparation package? We have online meetings, 40 online meetings. It's twice per week, every Sunday and Tuesday. Every session stays about 4 to 5 hours duration, and there is a break in between. In every day, whatever Sunday or Tuesday, I explain either one big topic or multiple small topics. These topics covering all what you need to know about MRCOG Part 2 knowledge. Coming from NICE guideline, I explain all. GTG, I explain all. Took articles, I select as much as possible. FSRH, almost everything. Behavior, almost everything. BASH, almost everything. Scientific impact papers, many of them. So we try to cover as much as possible. You don't need any other material. If you study everything in this course, you will not have enough time to study anything else. If you are very smart, that you could cover all the material in short time, okay, then ask me. Then ask me. There is very common question I always ask it at the beginning. Dr. Osama, is your material enough? My answer always, finish it very well, study it very well, then ask me what else I need to study. Okay? Deal? Finish our material first, very well, very hard studying, absorb it very well, then ask me what else I need to study. I will give you some advice about what else you can study more. But believe me, inshallah, our course will cover everything. The last time I counted the slides, they were more than 6,600 slides. It's too much, yes. These slides containing both the recommendation and the scientific slides and question and answer slides. Okay, of course, for the group, there is WhatsApp group. Okay, in this WhatsApp group, okay, you can ask if something is not clear. I can explain sometimes by writing or by audio. Sometimes you can ask me for a summary in Arabic if you want, because my language in the course is pure English. Sometimes you may ask, Doctor, please explain it in Arabic for me. Okay, I will send you audio on WhatsApp explaining it in the lay language of Arabic. So all of candidates in this course will have access to our website. Our website contains the PowerPoints, the videos, the quizzes, the question bank, everything you need. You don't need to subscribe for any question bank. Already we have question bank containing more than 3,000 questions and answers. Finish them, absorb them very well, then ask me what else source I need to have for questions. But finish at first the 3,000 questions. In the last month before exam, which will be in June for your package, okay, we have another course called the crash course. In the crash course, I summarize again, okay, the important things that we said in the long course, and I add some additional things. Sometimes there are changes in the guidelines within the last few months before the exam. In the crash course, I see if there are any updates and I explain them to you. Again, you don't need any other source to pass for MRCOG exam. Believe me, take the coming 6 months as a chance for hard preparation, hard studying. This will make you a brilliant doctor all over your life later. Just 6 months of good studying. So it's not just to have the exam and to have the membership. No, you are building yourself. You are investing in yourself. The time that you use for studying, the money that you pay to prepare yourself, you are investing in yourself. Okay, the most important project you can invest in your life is you. Invest in yourself. Okay, as long as you are living, okay, take courses, learn, take certificates. You are a doctor. We don't stop studying. So MRCOG is not the beginning and not the end. Whenever you stop, you will not be happy. I understand this. So you have to always update yourself. So mashallah, we have full comprehensive package, including everything. As we said, this is including nice green top, took articles, everything. You don't need anything else. You don't need any question bank because already we have 3,000, more than 3,000 question bank. And already after every topic I explain, there is a quiz library for this specific topic. For example, diabetes. Okay, you will find in the same PowerPoint, there are questions and answers for diabetes questions. These questions coming from multiple sources, including previous recalls. That's why from day one, you are trained. You are having training from day one to the recall questions. So our meetings are on Tuesday and Sunday. It's 12 p.m. UK time and 2 p.m. Egypt time. And this is the timing in Pakistan, India, and Emirates time. In every day, we have 2 sessions, every session about 2 hours, and there is break in between. So what topics we cover in this course? This list is dynamic, so the order I can change. And also I add more topics. So let's take an example. Systemic lupus with pregnancy, phenylketonuria, diabetes, DKA, early pregnancy problems, including miscarriage, ectopic, molar, and others, like pregnancy unknown location, hypertensive disorders in pregnancy, small for gestational age, maternal collapse, recurrent pregnancy loss, cord prolapse, intrahepatic cholestasis with pregnancy, thrombocytopenia with pregnancy, RBCs antibodies, cardiac diseases, preterm labor, psychiatric disorders in pregnancy, neurological disorders. Okay, for example, this day 10, it's one topic all over the day because it's a big topic. The same also in day number 7. It's one topic all over the day because it's a big topic. Breech presentation, external cephalic version, nerve injury in gynae and OBS, GPS, which is strep agalacti in pregnancy, intrapartum care, instrumental delivery, the same day, including also shoulder dystocia, and a nice guideline about CTG, fetal monitoring in labor, cesarean section, vaginal birth after cesarean section, Ogilvie syndrome, venous thromboembolism prevention, treatment, and ovarian vein thrombosis, breast cancer, bronchial asthma, appendicitis in pregnancy, multiple pregnancy, skin eruptions, renal diseases, liquor problems, amniocentesis, hemoglobinopathy like thalassemia and sickle cell disease, antepartum hemorrhage, postpartum hemorrhage, placenta accreta spectrum, intrauterine fetal death, abortion care, reduced fetal kicks, induction of labor, abdominal surgical incisions. One day for variable talk articles. Many of the previous topics are also talk articles. Okay, antenatal care, teaching and learning, thyroid in pregnancy, infertility. Okay, about here, we start the module of gynecology. All what passed was the module of obstetrics. 2 days for contraception. You learn almost everything about contraception and every method we learn it in details. Pelvic organ prolapse, laparoscopy, urogyne, it's complete day, endometriosis, inflammatory bowel disease, irritable bowel syndrome, hyperplasia, endometrial, cervical cancer and cervical screening program, endometrial cancer, obesity, Essex, social, hysteroscopy, abnormal bleeding, sexual abuse, governance, vulval disorders and cancer, ovarian cancer, ergonomics and laparoscopy, sepsis, postmenopausal bleeding, thyroid and infertility, and statistics. This list is dynamic. More topics will be added. And at any moment when you open the website, inshallah, this is the most up-to-date until this moment. That's why I recommend that you don't study from a book. Any book you study from, it's not the most recent. Even if it's published in year 2023, guidelines, more guidelines were published after this book was published. That's why any book is not up to date. Let's say today the RCOG published a new guideline. I summarize it and change its PowerPoint. So whenever you have access to this lecture, you find the most recent guideline. And here I have a good news. I know that some doctors can be not available for attending the online lecture on Sunday and Tuesday. Any other option? Yes. You can just have access to the website. So you can subscribe for access to the website, including the PowerPoints and the videos. Another good news. From day 1 in the course, you have access to the website containing all these topics. So in day 1, you have access to everything. So if you have a lecture you need to present in your hospital, no problem. Open the website, get the topic, read it well, prepare it. Okay, you want to study about breech presentation. Okay, even if we didn't explain it yet, you have access to its PowerPoint and video. The video was recorded in the last course, so within the last 6 months. After every lecture, I change the video to upload the new one and remove the old one. So inshallah, the material always the most up-to-date. More up-to-date than any book. That's why I recommend that part to studying is online studying, not from printed source. Any printed source, once you print it, it starts to expire. In the crash course, we revise most of the topics I said, and I add more because sometimes new guidelines can be published within the last few months before the exam. Or if there is an update, or I find that there is a specific point I need to re-explain it again because you were asking about it. So I can add more, I can summarize, and of course, in the crash course, we solve many questions. Alhamdulillah, in the last course, that the candidates, they had the exam just 2 days ago. Okay, we solved it together, more than 6 recall exams. Okay, it was discussed and solved on Zoom with them. Again, long course. In the last months before the exam crash course, every topic has in the PowerPoint questions and answers after explaining the topic. Also, there is a quiz specific to every topic. So today I explained the diabetes, for example. You can have access to the quiz about diabetes. So the questions you were trained in the PowerPoint, you will find them in the quiz, you will answer, you submit, you get your score. Then you will know which questions you should have solved better. So it's not weekly exam, actually. It's multiple weekly exams. So every day we have a meeting, there is an exam for this day. You need to solve it, and you have to share on a specific WhatsApp group your score in this quiz. Because I count how many quizzes you solved. And every month in the course, we say, thanks for Dr. So-and-so. He was the one with the highest number of quizzes solved in this month. So I am following you. So you will not study alone. I am following you. I know who is solving and who is not. So we can encourage anyone who is not active in solving the quizzes. Okay, this is an example for my website. Okay, you need to make an account. Then we give you access to the course material, so you can find the material in your profile in the website. Okay, again, even if you are not a course member, you can subscribe for access to the website, including part 2 material. Okay, this is an example from the previous version of the website. Okay, you will find a list of the topics. You can press any one. Under every topic, you will find the PowerPoint and the video, so you can study from. And also the quiz for every topic. PowerPoint, video, and quizzes. The PowerPoint has no voice. The videos, they have voice. Then the quiz, you can solve it and get your score. Okay, for example, this is a topic. So you'll find the video or the PDF, usually PowerPoint, the PowerPoint, then the videos, then the quiz at the last. Okay, this is an example for the quizzes, the questions and the options you solve, then next, and at the end, submit. You get your score, then you will know what was the right answer for the questions. And you can solve the quiz unlimited number of times. You solved the quiz, you want to improve, okay, you can do retake and solve it again one more time. So you can send me the higher score you got for this quiz. Alhamdulillah, all over the 7 years, all over the 14 batch, and this is batch number 15, Alhamdulillah, our feedback is always good because we try to do our best in this preparation. Because it's my responsibility to try to give you the best care. Okay, yes, I am a busy obstetrician, and also you are. That's why you are here, because you are coming here to take help. Okay, because as we said, MRCOG material actually is very big. You are talking about all guidelines published by UK about gynae and OBS. That's why you are here, so it can be summarized and made easier for you so you can understand it in the shortest possible time. So you can give more time to your work and to your family also. Okay, that's why we are here to help you to study MRCOG in the shortest possible time. Is it very short time? Of course not, because I cannot remove some topics. And this is a challenge to me because always the material is increasing. New guidelines are coming. Every guideline coming, there should be a lecture for it. That's why when I started since year 2017, the material was smaller. With every batch, it's enlarging. So there is positive correlation between the number of years and the amount of the material. It's really increasing. That's why the challenge is more hard. That's why we try to give more help. Okay, please, again, don't take it lightly. Take it serious because the challenge is high. Okay, there are hundreds of candidates all over the world trying to pass this exam. So you have to be among the best candidates preparing for it. So you can have a high chance for passing. Okay, again, these are screenshots for the feedback all over the 7 years of part 2 courses. Okay, alhamdulillah, always our feedback after the exam that always they remember my voice in the exam when I was explaining this topic in the lecture. Okay, this was like a questionnaire. So every one of them, this is a comment from one doctor, this is from another one, and so on. This is in Arabic. Sorry, in Arabic again. Okay. Please, in our WhatsApp group that you joined within the last few days, there is a Google form. Please fill it so I can know some data about you so we can communicate better. And please, if anybody has any question about how to prepare, there is only one item I will say. It's about without having a course, how we can study for MRCOG part 2. So let me show you, then we can start to receive your questions. So on the RCOG website, okay, you can